So welcome to our very first National Family Caregiver Month event for November 2025. And we're going to be hearing a presentation from our very own Danny Lee. She's with our HUD-VASH program. And for those of you who don't know, that is one of our programs that works with homeless veterans. And she's going to talk to us a little bit about caregiving for somebody who also struggles with substance use or is in recovery, maybe at one time did struggle with that. So Danny, you want to click to the next slide real quick?
Mm-hmm.
So just a reminder that this presentation is going to be recorded and posted on our YouTube channel for public viewing. So just be cautious if you're going to be sharing any personal information with your questions and whatnot about that. We would be happy to follow up with you afterwards. But if you have general questions and whatnot, we are happy to answer that towards the end here. And as Danny gets going, we're going to shut our cameras off because she has a couple videos she's going to show, and it just works a little bit better when the cameras are not on. So I will turn it over to you, Danny.
Thank you, Erica. All right, so again, my name is Danielle, and I'm a social worker and licensed addictions counselor here at the VA. And like Erica said, I work with the homeless program here, and I have been doing so for 5 years. So it's just to give a little presentation on caregiving for someone who has or currently is struggling with substance abuse. If there is any questions or concerns or issues with the audio or PowerPoint or video, feel free to stop and let me know. So what we will discuss today is what substance use is, what that looks like, commonly referred to as alcohol and drug use. Substance use is generally a little bit more clinical of a term. But so we'll discuss a little bit about what that looks like and what that is, how it impacts the folks who are struggling with that. But if you've had any experience with a family member or a loved one who's experienced addiction, you know that it doesn't just impact them, it also impacts those around them. And so we'll discuss that as well and kind of how that impacts the people around you, especially you as a caregiver. And so we'll discuss also what you can do to help a veteran who is struggling with substance use or alcohol and drug use. And then as a caregiver, where you yourself can find some support or some resources for yourself as well. And that leads us into thinking about addiction as a pattern of kind of dysfunctional behavior. So this here on this slide, this is the DSM criteria, diagnostic criteria for substance abuse. And when we think about it, for a more broad perspective, again, it's not so much just the alcohol use or the drug use or substance use specifically relating to that substance. It's about what's happening surrounding it. So with addiction, we see a continual use despite negative outcomes from using whatever substance it is, or alcohol or drugs. Like with the kiwi, we saw that seemed like bad things happened to him. The falls were rougher. He got roughed up. He started looking a little beat up around and not doing so well. There seemed to be some pretty negative outcomes. The world got a little darker. There seemed to be some injuries or the kiwi looking a little rough, but continuing to use that even though there were negative outcomes of it. And then thinking about the kiwi video, it seemed like each time the kiwi used that nugget or saw that nugget, the effect wasn't the same. And in the professional world or clinical jargon, we tend to call this tolerance. And that just means that someone starts using and they need to use more drugs or alcohol or whatever the substance is to get that desired effect. So for the kiwi to get that same effect as the first time that he got, which it seemed to be like what he was chasing throughout that video, you need to use more. There's also the spending a lot of time trying to use alcohol or drugs and also recovering from the use. And like in the Kiwi video, running towards it that time or having those harder recoveries. For someone in addiction, that might look like spending more time and then maybe also neglecting some of those responsibilities, which is another criteria for that substance use. And even when it comes to recovering, it might mean recovering from use, having longer and more challenging withdrawals, and even potentially needing medical intervention, especially with alcohol, since withdrawal from alcohol can be very dangerous and even deadly. With addiction, there's usually unsuccessful attempts to cut down or stop using. When clinicians talk to people about substance use, that's usually one of the questions we ask is if they've tried to cut down or stop using before, and if that was successful for them or not. Or sometimes people have periods where they're able to successfully cut down or stop using, and then they maybe use again. But it's usually, and there's research on this that supports that people usually try to cut down or stop using multiple times before they're able to really get into a place of sobriety or some recovery. And then with addiction, there's the prioritizing of drugs and alcohol over other responsibilities and relationships. If you're caring for someone who's struggling with addiction or has struggled in the past, you've probably felt this, where you felt like that person was prioritizing that substance over you or over the relationship with you or over other family, friends, responsibilities, work, whatever that may look like for them. And then lastly, again, just those withdrawals. And withdrawals are just the usually uncomfortable side effects of not using anymore, whatever that substance is. And there's physical symptoms and mental symptoms of that withdrawal, whether mentally psychological ones might be some irritability, mood swings, some anxiety or nervousness, maybe some paranoia or distrust, and some restlessness. For physical symptoms, there might be some difficulty sleeping, some appetite changes, maybe they're wanting to eat more or eat less. There might be some shaking or DTs or delirium tremens as we call them, nausea, vomiting, headaches, things like that. And we'll talk about that a little more as we go on in this presentation as well. So when we talk about someone with a substance use disorder, there's something that we talk about with clinically. We talk about some risk, and there's various assessments that clinicians can use to kind of help determine somebody's risk for where they're at with their substance use disorder, if they meet that criteria or not, and kind of where we go from there, and kind of what interventions there might be at different places. So if someone's not using or using very little and they're not having some of those impacts or those behavioral impacts on their life with different substances, they might not report any issues or problems. Other times it might be there's maybe some impact on their life or maybe concern from family or friends or things like that, and that might just mean some ongoing assessment or monitoring, might mean brief interventions. An example of that might be sometimes people aren't sure if how they feel about their substance use or alcohol or drug use, and there's stages of change that people can be in, but somebody might say, well, I don't have a problem with that, or I don't know, or they might feel uncertain whether or not they do. And so there's an example might be an evidence-based practice called motivational interviewing. And that's usually 2 to 3 sessions, maybe even just one, where a clinician can work with them and kind of help them better determine what they'd like to do or where they're at. Moving moving on, there might be some more risk or some more criteria for substance use that's met. And with that, there might be some additional resources, some additional counseling or groups supported. So with the VA, there's different groups for veterans to participate in. There's group counseling, there's some outpatient counseling in the community or at the VA. There's groups that are peer led, so not led by a licensed clinician, but those might be like Alcoholics Anonymous, Gamblers Anonymous, Narcotics Anonymous, things like that. That can also be options for people. And then if someone's struggling they may be at a higher risk, they might do some intensive treatment or intensive inpatient treatment. And with the VA, that might look like ROTP or residential treatment options where they live at a facility for 30 to 90 days, depending, and they get treatment while they're there. And if that risk is high, there might also be, depending on the situation, a need for some medical intervention. Some withdrawals are medically assisted, for example. So withdrawals can look different depending on where they're at with it. And again, withdrawals happen when someone stops using alcohol or drugs. So within the first 8 hours, it might just be some of the irritability, anxiety, maybe some feelings of depression a little bit, some nausea, shaking. Again, those kind of DTs like we mentioned earlier. In that 12 to 24-hour window might more look like headaches, cold sweats, moodiness, depression. Sometimes, depending, can also be some physical pain as well, a little bit. And then after that, it can be some tremors, seizures, throwing up, or some delusions, hallucinations. Those are things that are generally with longer or more extended use, or someone who's been using for a really long time, especially, and they might be in a hospital setting at that point, especially seizures, obviously, medical emergencies. After that 3 days to a few weeks, some symptoms can start dissipating. We'll also discuss this a little later too, but some symptoms or addiction symptoms can kind of persist long term. We'll talk about that a little bit as well. So if you're caring for someone who's older, there's some special considerations maybe to keep in mind. So just to kind of go over that a little bit, if someone's older, maybe they have some health issues already, and they're also using or have used in the past, those health issues can be exacerbated by that substance use. So an example with dementia and ongoing alcohol use. There's also a type of dementia called Korsakoff's that can be exacerbated by extended or continuing to use alcohol. Alcohol or drug use can also mimic some of those behaviors that we see with age, regardless of whether or not someone uses drugs or alcohol, such as balance or some of that cognition or mood or memory. Those things are already happening as we age, and substance use can impact those as well, or even mimic them. And sometimes it's hard to know what's coming from what, whether or not something's related to substance use or whether it's related to kind of their baseline health or cognition or where they're at physically. And then as we age, we have changes to how we metabolize or process substances in our system. So our body changes as we age, and sometimes those substances may take longer or have a harder time being processed out of our body, especially if we have other health issues. And then what we see, especially with long-term use of alcohol or drugs, is cognitive impairment. And somebody who's older might already have some cognitive impairment, which may be exacerbated by substance use. But some of the things that you might experience with caring for someone with those things is when someone has used substances for a really long time, that impacts their brain and it makes it harder for them to plan things, to be able to know how, and to be able to actually complete tasks because the frontal lobe is developed, and the frontal lobe is where it's called executive functioning is that, and that's just where we can plan and execute some of those tasks. So for example, with that, if we think about, like you or I maybe think about doing the dishes, that we think about doing the dishes and we just think, oh, we'll do the dishes, and we don't maybe think beyond that. But someone who really struggles with some of that cognitive impairment, whether from long-term substance use or age-related issues, might need a little bit more help with how to break that down. And just saying to take a shower or to brush your teeth or to do the dishes or those kind of things might be really hard for someone with some of that cognitive impairment. And we might need to break that task down into smaller tasks. So I don't know if any of you are familiar or have done the tell someone how to make a peanut butter and jelly sandwich exercise. It's where you tell someone kind of how to make a peanut butter and jelly sandwich, and we take it for granted because it's so simple and second nature to us. We just know how to do it. But when you think about how do I break this down and say how to do this task in a way that this other person will understand, it becomes really challenging. So if we think about doing the dishes, or we think about telling a loved one or a veteran with some of this cognitive impairment how to do a task, we might have to break it down into really simple, smaller chunks that we don't necessarily think about. So if we think about how to help someone, tell them how to get in the shower, take a shower, take a bath, we might need to break that down further into the actual steps that takes. So like taking off the clothes, checking the temperature of the water, turning that water on and checking the temperature before we get in to make sure it's not too hot, not too cold. Might be which body wash or which, shampoo or what do we use and where do we use that. And so breaking those things down into smaller, more manageable tasks is something that we may need to do. We may need to also repeat information multiple times, many, many times to get information relayed or to help a veteran that we're caring for. Sometimes when we have, especially with long-term substance use, we have a hard time retaining information and remembering. And so we have to repeat ourselves a lot or repeat information or appointments. For example, like someone has an appointment coming up, you may need to remind them of that multiple times. So when we think about recovery and what that looks like, we think about it as a lifelong process. You can think about recovery not just from like alcohol and drugs, but you can also think about it with other things to better understand it as well, and how this is something that you do for life. With addictive behaviors, we talked about a little bit before with some of the withdrawal symptoms, but the behaviors can persist as well for a longer time. And those can persist for life. So even though someone, if they're in recovery and they're not using anymore, sometimes it's really confusing and frustrating because they might still do some of the things or have some of those same behaviors that they were doing when they were using. And sometimes that's commonly referred to as what's called dry drunk. And it's similar behaviors to what they were using when they were drinking or using drugs, but they're not doing that anymore. And that can be really difficult to work with and very frustrating for caregivers, but it's part of the disease of addiction. And so thinking about that like a lifelong process, think about it like if you're trying to lose weight, right? Like there's crash diets all over and people diet and maybe gain weight back or things like that. But when we're trying to create a lifelong change, a healthy habit and develop that, that is something that we have to maintain for life. We can't just do our diet and then go back to eating how we were before or doing the things that we were doing that caused us to gain weight in the first place, right? So it's a lifelong process in weight loss. I've heard that referred to as like a lifelong maintenance. Same thing with addiction. It's a lifelong maintenance that having to maintain that sobriety and those behaviors that help them be sober. And we can talk a little bit about one of the challenges with addiction and caring for someone with addiction is if they don't want treatment. That is a tough position to be in, and it's hard to see someone that we love and care about struggling in this way and feeling like we can't do a lot about it. The thing is we can't force someone who doesn't want treatment to get that treatment. If someone doesn't want that help, we can't force them to do that. If there's a legal order in place, that's a little different because then the person has similar rights to like if they were a child. But in treatment, even with that, they have to still be able to participate in treatment in a meaningful way. And what that looks like is someone who's able to understand the information that's being presented to them in treatment. So if they're in a group session where they're learning about addiction or learning skills to be sober or be in recovery, they have to be able to understand that and retain it and be able to participate in that. So, and that's sometimes a difficult gray area for people when we want them to get help, or even if they want that help to be able to engage in treatment in a meaningful way to get what they need out of it. So there are resources to support caregivers, and we'll talk about those at the end as well. So what is your role as a caregiver? This is sometimes difficult is to best understand, and it's hard, especially when it's someone that we love and care about, of course, to understand how we can best help them in a way that's truly helpful and not enabling in any way. So with your role as a caregiver, it's to help the veteran with tasks that they're not able to do themselves. So we're not doing things for them that they could do for themselves. We're helping them with the things that they can't do on their own. So if someone's unable to bathe or shower, for example, independently, then that's something that we would help them do as a caregiver. For example, with PTSD, that's really one of the really common things that people with PTSD struggle with is crowds and being in public spaces with a lot of people. So maybe grocery shopping is a challenge. And as a caregiver, we can help them with reducing avoidance of grocery stores and helping them to be able to get the things that they need at the store or be able to be in crowds and reducing that avoidance of the community or of socialization or of just even being able to get those kind of daily errands done that we all have to do. The goal of caregiving is to ultimately be able to help get to a point where we can decrease some of that assistance over time. So we're able to help the veteran that we work with be able to get the skills and maintain the skills and work on those skills to be able to do things for themselves. We're ultimately working to empower the veteran to be able to do as much as they can for themselves. And of course, we can help them as well by encouraging them to obtain or attend their medical appointments, mental health appointments, and that's part of our role as a caregiver, and to be able to help the veteran maintain their skills and well-being as much as possible. There's challenges, especially with addiction, and that it often creates some pretty dysfunctional dynamics, right? So there's all sorts of dysfunctional family roles, and this is kind of shows what some of them are. The one that we're going to talk about the most, though, today is the enabling role. And that's a really difficult dysfunctional family role that addiction very often puts caregivers in. And sometimes it's hard to know that balance as a caregiver of what's enabling and what's helping. And so we'll talk about that. When we enable someone, it comes from a place of compassion and love and care for that veteran, for that person in our life. Again, it's hard to see someone that we love and care about struggling and not want to help them or do things for them. But sometimes the best way that we can help is by not enabling, but stepping back a little bit. So sometimes we want to protect the person that we love from being uncomfortable, stressed, upset. And so that's the short-term benefit is, well, the veteran no longer is going to be stressed or frustrated or have to be uncomfortable with this thing. It can also benefit us. I don't know if any of you guys have heard the phrase, but I have an aunt who says it all the time. If you want something done right, you have to do it yourself. And that's a really common mindset to get into, and especially if you're a caregiver, sometimes that might be a mindset that we get into as a caregiver as well. It's sometimes just easier to do something for a veteran in our life than having them do it. It's sometimes just easier, quicker, more convenient to just take care of something ourselves. Sometimes saying no is really hard. Sometimes we want to just avoid an argument or a confrontation or difficulty. And so we just take something on ourselves. Maybe it saves time. But that's not always the most helpful thing, especially in the long term, that we can do. We're thinking about how do we balance that enabling versus helping. We don't do damage, even if it's unintentional, or set someone up for failure in some way, even unintentionally. So thinking about enabling versus helping, when we enable someone, we encourage them to kind of stay where they're at with the skills that they have currently, with where they're at mentally, physically, whatever that may be right now. And ultimately, even if we're not intending it or we're not thinking about it like that, it can send that message of you're not capable of helping yourself. Like thinking of the butterfly video, having the help out of the cocoon, you're not capable of getting out of the cocoon yourself. You need help. When maybe we just need a little time and a little guidance. When we think about helping someone, we're adding value to their life. We're empowering them to help themselves, to make decisions for themselves, to do things for themselves, to not stay in the same place that they're at. We're helping them and aiding them in their progress in life. We're encouraging them to continue to be independent as they can be. And enabling doesn't just hurt the veteran potentially, but it also hurts the caregiver. If you think about what we talked about before with, well, I'll just get this done because then it'll be easier for them and for me as well. You might be feeling frustrated, and often that frustration for you isn't necessarily alleviated when you're doing that for someone, that task for somebody. Maybe you're doing that while feeling frustrated. That frustration over time, those many instances of feeling frustrated by the things that you're doing for the person, can ultimately lead to resentment and burnout, feeling depleted, like we have nothing left to give. And that's a really difficult place to be as a caregiver. And so we want to prevent that by doing more of the helping. Maybe that looks like putting things back on the veteran to be able to, that they are able to do themselves, that you know that they're able to do, even if it's not the easiest thing in the moment, whether to watch them have a difficult time or to work through it. Like the video talked about, we never want to see anyone go through a hard time, But sometimes those hard things are the things that make us who we are and the things that make us grow as a person. And so I wanted to leave you guys with some resources for support, because as a caregiver, that's hard enough. It's hard to be a caregiver sometimes, and we need some support too. You know the saying, like, can't pour from an empty cup. So there's some resources for caregivers, one of which is the Caregiver Support Group, of course. And then there's for kind of addiction specific support, there's a thing called Al-Anon. And if you've heard of Alcoholics Anonymous, which is for the person struggling with alcohol use, the person themselves, or Narcotics Anonymous or Gamblers Anonymous, those are for the person who's actually actively like struggling with those things or working towards recovery or in recovery. There's Al-Anon, which is for the family or friends or the people who are impacted by that person struggling. And that's a place for you to be able to get support and talk about and get and share about life and struggles with caring for or being involved in the life of somebody who's struggling with addiction or recovery. There's also a couple books, one of which is It'll Never Happen to Me by Claudia Black. Claudia Black grew up in a family with addiction, and so she talks about the impact of addiction on other members of the family. And she talks about some of the dysfunctional family roles and how those impact us as we grow up, as we care for others, and as we become adults and experience life, even out once we're no longer in a family that we experience that addiction in. And then there's also Codependency No More by Melanie Beatty. And codependency was kind of talked about first with the people who are that family member, those caregivers, for people who are for people with addiction. And so it's really talking about how do we shake off that responsibility for other people's experiences and feelings and the struggles that they're going through, and not make it or put that responsibility on ourselves, but take care of ourselves and take back some of the control that we have in our own life, rather than trying to control in the lives of others. We're trying to focus so much on other people and make sure that we're also taking care of ourselves.